Good afternoon. I first want to start off by thanking our witnesses for being here today and for your service on behalf of this country. Especially our first responders in our second panel, we thank you as well. And I'm particularly encouraged with Mr. Gabriel with his background of being a first responder. I think the administration did a great job of getting good people in the right position. So we look forward to working with you. Traditionally, when we think of first responders, we tend to think of public safety, police and fire. They are always the ones that are there. But today we're expanding that definition and I think getting a sense of the other individuals who support our first responders on a regular basis. Since 2004, the United States Postal Service has worked with the Department of Homeland Security and the Department of Health and Human Services to develop a system to augment the point of distribution network, to facilitate a rapid distribution of countermeasures after a biological attack. In 2005, the Center for Disease Control recognized that if a major biological event were to overwhelm local response, invoking our letter carriers in the process would be critical to saving lives. The critical role of the United States Postal Service can play in distributing medical countermeasures was recognized by President Obama in an executive order 13527, which directed the federal government to develop a national U.S. Postal Service medical countermeasures dispensing model to respond to a large-scale biological attack. Today, the resulting national postal model is in operation in St. Paul, Minneapolis, and we look forward to hearing about your success as well as the new program to be launched in Louisville, Kentucky. The program's success can be attributed to the patriotism of postal workers and the careful planning on behalf of HHS, DHS, and the Postal Service, and many other federal, state, and local partners who've worked together to ensure that the postal employees who participated in this program and their families have access to pre-positioned medical countermeasures. Now, when we look at this issue and these very tough fiscal times, I find it ironic that we're having a discussion about including other folks in our first responder model, particularly our letter carriers and postal workers, when we're just over on the Senate side having a discussion about whether we're going to maintain 6 days a week service and keep postal offices open. So it seems kind of ironic. Here we're talking about giving more responsibility and utilizing a resource that we know is needed, yet in the same vein we're talking about cutting it and could very well eliminate our ability to use this program. Therefore, I urge in the testimony a real frank discussion about the potential impacts of this program and whether, if some of the proposed changes are brought to fruition, do we really think that they would be met in light of some of the potential cuts that are being proposed. I question if, in fact, that can happen. Further, some of my concerns is that there's been a delay in issuing the guidance, and we look forward to getting some feedback on when that can be expected. And then finally, with this committee, I'm hoping that we will, in fact, bring up to markup H.R. 2356, which was pulled, the WMD Prevention and Preparedness Act of 2011. Which would have a great impact on medical countermeasures for first responders. With that, I thank all of you, both panels number 1 and 2, for your willingness to testify and the information that you'll share with us to make better decisions on behalf of the American public. With that, Mr. Chairman, I yield back the balance of my time.
Thank you.